So I think the issue is that in our current society, a lot of women are having babies later in life, and they've also developed other comorbidities by that time. So for example, more people might be obese, they might have diabetes, they might have high blood pressure, and when you add all of those things together and then you put the body through being pregnant, it's a big undertaking. It can be very stressful, and it does change a woman's body. And for some women, these changes are important for their future health. So there are some people who actually will look at all of their risk factors after having had 1 or 2 children, maybe having preeclampsia once or twice, and say, you know, just knowing my risks from what I've already been through and my family history, I think I'm ready to stop having children and start on my medications and start really focusing on my health. And the benefits of going through another pregnancy or the risks of that are just too high for me. So I think it's important to acknowledge that people have concerns. I don't think it's ever helpful when a doctor just blows off somebody's concerns and says, oh, that's not true, or that never happens. You know, we really have to listen to what patients' impressions are, because that's what's going to determine whether or not they take the medication. And at the end of the day, that's our purpose, is to help them take the things that improve their health. So I think it's important to know what they've heard before, know what their concerns are, and then also check in frequently. Because if something develops, sometimes we have answers for some of those problems or those side effects. Sometimes we might not, but I always want the patient to know it's up to them. I can tell them that they have a high risk of heart disease, and if they accept that and don't want to take any kind of cholesterol-lowering medication, that's still their choice. But I just want them to know the implications. And everybody has a right to the information and to decide themselves what they really want.